Hi, and welcome to Mindful, Beautiful, and Thriving, a podcast series by Tharaka Foundation focused on youth mental health. Before we begin today's episode, I just wanted to let you all know that all content that is found in our podcast is created for informational purposes only. This content is not intended to be a substitute for professional medical advice, diagnosis, treatment, or therapy. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition, and never disregard professional medical advice or delay in seeking it because of something you have heard in this podcast. Thank you so much, and without further ado, let's get started.
Hello, everyone, and welcome back. For the past two episodes, we've been learning about the gut brain axis and the science behind why we say we have the butterflies in our stomach. We've also learned how we can uplift ourselves to feel lighter before high pressure and stressful activities. Today, we're joined by the extraordinary Dr. Margolis, and together we'll unpack the science behind anxiety and depression and their interaction with our gut. From what I've understood so far, our enteric and our central nervous system are the pathways that connect our gut and our mind, along with the vagus nerve and our spinal cord. So, can you explain what goes on in our nervous systems when we feel anxious and stressed?
Sure. A number of things. So, when you're feeling anxious, there's a variety of hormones that are released from your brain that then circulate down into your gut. These activation systems in areas of the brain, like the amygdala, become hyperactivated and you generate what's called a fight or flight response. And so that's the response of when you feel like there's an emergency or a trauma or something bad is going to happen. And so, what happens often is that those hormones are released, you feel that way, you feel that fight or flight, and oftentimes what happens then is your gut can slow down. Because when you're in that fight or flight mode, it's like when you go into the forest and you have a bear running after you. And when that bear is running after you, the last thing you want to do is have to stop and use the bathroom. So that kind of stress response is actually a way to protect ourselves and to help preserve our safety, say, from that bear. Unfortunately, sometimes though, anxiety, because I think our systems were generated and our bodies formed many thousands of years ago to probably really run away from those bears, that even in today's society, when we feel anxious, we still may feel like we're running away from those bears, even when that same threat doesn't exist. But exactly what happens is that's translated. What we also see, which I think is really interesting in chronic stress and anxiety, is not that when you have it, it's situational and then it just goes away. What's been shown is that chronic stress can actually rewire those gut brain connections and can make it so, the next time something happens that you might be primed for that event. And I don't know if you're going to talk about early life stress and kids and what happens, but that's like a very sort of similar phenomenon that when kids are brought up under tough circumstances, we call them adverse childhood events. So something like domestic violence or some sort of abuse, that as kids are growing and their brains are becoming wired, they wire in almost different ways. And so a lot of times these kids grow up into both teenagers and adults who end up having more anxiety, more abdominal pain, again, because those systems are developing differently, or when chronic anxiety is happening, those systems are rewiring.
Yeah, thank you for bringing like the scientific point of view for the last point you just mentioned about like seeing the ACEs in your childhood, and that I thought that's just what you would internalize, but and then that's why you would have high anxiety or something. But I think you really showed that it's actually because the way your brain rewires and then your gut also rewires in those same connections. And then you also talked about how, yeah, you also mentioned that when we're feeling anxious, right, then in our brain we're in the flight or flight mode, which is then translating and communicating with our stomach, which is why we feel really anxious in situations where it's not even a big thing. And I know I do that a lot too. Like it feels like a tiger's chasing me when it's actually a really safe environment. So
That
yeah, I think he explained that really clearly, that when our mind is overloaded, overthinking, when we feel like a bear is running after us, our gut stops working and pays full attention to our mind.
But what I also want to say is I don't want to make it sound as bleak as I'm saying when I talk about rewiring. What I want to say too is that the brain is really plastic and the gut is too. And what that means is that even as an adult, you can rewire some of those connections. So when you think about different medicines have been shown to rewire the brain and the gut, therapy has been shown to do that. So even though you may get a rewiring of the brain in ways that can, say, make you more anxious, there's also ways to rewire your two nervous systems in ways that really can help you feel better.
Yeah, I think you bring a great point about neuroplasticity, and I would normally think that neuroplasticity meant that you can only change like the way the neural connections are in your brain, but I think it's really cool how we can also change that in our gut to make our gut more healthier.
And in our gut brain connection.
Yes, and in the way they communicate.
Yes.
So when we say we have butterflies in our stomach, what does that mean? What's going on in our gut?
Sure. So that's a feeling of anxiety in your gut. So that what's happening there is that you're feeling that kind of anxiety that you feel in your brain, and that's transmitting to what you feel through those highways of communication. A lot of times, the way to get rid of those butterflies in your stomach is exactly the way that we said, are to de-stress, because it's a communication that's causing, say, different types of transmitters to be released in your gut that give your gut that anxiety that your brain is actually experiencing.
Got it, yeah. And I've noticed, at least when I get sometimes anxious, then it's like a lot of overthinking that's happening, and a lot it's like running around in your head. And you like, have you seen Inside Out too, when they explain, when they show the anxiety attack with Riley, that's like what's there's like a lot going on in her brain. So I'm assuming like the when we say butterflies in our stomachs also like rumbling around, there's a lot going on in there. Is that where the saying butterflies came from?
Yeah, I think so. I think you've hit it on the mark. And I think that's where it is. I think it's a very natural feeling to have. And I think it can also help to know that when people get nervous and you get those butterflies in your stomach, it's a natural response. And those are the times to do those jumping jacks.
Yes. And on this topic of anxiety is one of the most common mental health challenges youth face across the world today, and that comes hand in hand with stress. So, our research showed that in 2025, around 45% of high school students in the US felt stressed almost every day at school, and that the US is ranked the first country with the most stressed students. So, how do you see the gut issues impacting stress and anxiety? And how does it work the other way around too?
Sure. Yeah, it's been really hard to see that mental health in general has really, the rates of anxiety and depressive like disorders have increased across all populations. But when you look at it, our young adults and kids are really increasing at those highest rates. And I think there's a number of factors with that. The world today is stressful. I think social media, like we talked about in a prior podcast, can be really hard. When I was your age, we didn't have doom scrolling. There was no such thing as social media. So we didn't have those things to look at and to cause anxiety. So how does that affect us? I think certainly I forgot what the I forgot what the initial question was. I'm
Yeah,
sorry.
I was just wondering on like how gut issues impact anxiety and stress, and then how it also works the other way around.
Sure. So I think that when you have an anxiety disorder or even just stress, it again releases those hormones, stress hormones in the brain, things like cortisol, that can then communicate with those highways that go down to your gut. It can give you those butterflies you've talked about. It can cause abdominal pain. You can feel again like you're running away from that tiger and your gut is going to stop moving as well. So you may get constipated or you may get nauseous. And similarly, I think that when people have chronic abdominal pain or chronic nausea, it gets you very nervous as to what's causing it, what's going to make it worse, how can you make it better, and is it going to stop you from doing things? So I think there's this really hard feedback loop that happens with this, and that because of this continuous communication, that when people are healthy, the gut and brain really help one another. But the problem is that when one isn't as healthy, it can directly affect the other.
Yeah, I think you put it very nicely and said that when like the gut and the brain are healthy, they work properly, but if one is unhealthy, that influences the other one. It's like a ripple effect. And yeah, I think you also mentioned that when you feel anxiety in your brain, that releases those like anxious hormones, which then go into our gut. And since our gut has those same neurons, then that also, and microbiome, that impacts our gut too. And now I'm wondering, is this the same thing that happens with depression? Because as we've known, like along with anxiety, depression rates are also like skyrocketing. And so a mental health report actually from 2025 showed that almost half of the youth in California reported struggles with depression. Just ask you again, from your work, what correlation does depression have with our mental health state?
Sure. It's a hard question to answer because anxiety and depression occur together so frequently that and sometimes people who are anxious are actually depressed. People who are depressed also have a lot of anxiety. So it can be really hard to figure out when a patient or when a person has strictly anxiety or strictly depression. So I think a lot, what the studies show are accurate in that when you have anxiety or when you have depression, that there's a much higher rate of gut problems because of this link between the gut and the brain. However, I think it can be really hard to discern between the two. And this is often shown in a lot of the medications that we use, like a lot of the medications that we use for depression, like SSRIs like Prozac or SNRIs. These things are also used to treat anxiety and anxiety-like disorders. I think because it's so hard to differentiate between the two. So, when I see patients come in and they have gut problems, and I'm not sure whether it's anxiety or depression, again, because those same gastrointestinal issues can occur with anxiety or depression. I will often recommend, if they're not seeing a psychologist or a psychiatrist, that they see somebody so that we can figure out what that diagnosis is and what the best medications are. And I'd say that in a lot of the patients that I've worked with, I work very closely with psychologists and psychiatrists because it's so important to understand what's being treated in the brain because it's an indirect link to treating the gut as well.
Yeah, that's really cool because I actually came in thinking that maybe the symptoms for gut issues would be different from anxiety and depression. We've actually shown that they're the same, and it's actually harder to differentiate between anxiety and depression, which is why it's actually good. Again, they're using a holistic approach and working with psychologists and psychiatrists too. So, yeah, and then now we've talked about the problem, we've talked about how your gut impacts your mind, your mental health state, and how those just keep talking and communicating with each other. So I want to shift gears into the actionable and simple steps we youth can take today to improve our gut health and our mental health being. So what would you recommend for youth?
Sure. What do I see the most? I see a lot of fast food, a lot of packaged foods, a lot of cookies, cakes, high sugar foods. I see Starbucks jammed in the morning with kids getting frappuccinos and coffees. And I think, cutting caffeine. Caffeine is addictive. It can make you anxious. It can then cause this drastic fall in the afternoon, making you tired and depressed. Sugar can have a similar effect. So you really want to try to have foods and drinks that can really stabilize your blood sugar levels and stabilize your energies throughout the day. So I always say if you're going to have carbs, maybe have some protein too to help level out those sugar levels. Try to have as little caffeine as possible because it's really better to be off of it in general if you can be. And starting your day with some exercise or even a walk to school as opposed to taking the bus if you can do it, or get off a stop early and walk to get some energy and some exercise in that way. And I think having a good sleep routine, I think, especially when you talked about the pressures of school and studying, and there's so many pressures with that today, really making a regular sleep schedule so that you know you're going to go to sleep at a certain time of night. Stop screen time at least an hour before bed, because those are the things that keep you up at night. Doom scrolling before bed is terrible for going to sleep. And even just looking at that light on the screen can really keep people awake and make that hard. So I think these are pretty simple ideas of things that you can do that in general will lessen anxiety, give you more energy, and keep you really focused throughout the day.
Yeah, I completely agree with you. And I think you brought up wonderful points about number one, like sleep schedule, because sleep is when your brain and your gut and your entire body gets to reset for the next day. And then the less sleep you get, the less time it has to actually reset, meaning you wake up the next morning, like you're bound to go to school, but you wake up with like a body that's not fully reset, so you're working on yesterday's body today. And then I think also mentioning about exercise, and when you do work out, and I think we've talked about this previously too, that releases like some good happy hormones, at least for me, and then you just feel better after that. And so I think you shared a lot of good actionable steps, and thank you so much, Dr. Margolis, for an eye-opening conversation today. I'm fascinated by the correlation between our gut and our mind, and I can't wait to uncover more with you in our next episode.
Great. Thank you.
You are listening to Mindful, Beautiful, and Thriving, a podcast series by Tharaka Foundation. As part of our youth series, we will be releasing new episodes every month, so make sure to continue to check those out. We hope you enjoyed this podcast, and we thank you so much for listening.